Hey everyone, and welcome back to the channel. Today, we're talking about something that can be pretty alarming for any pet parent, finding a sudden, soft swelling under your furry friend's jaw. While your mind might jump to the worst-case scenario, one common cause is actually something called a salivary mucocele. It sounds complicated, but we're going to break it all down. What is it? What causes it? And most importantly, what can you do about it? Let's get into it. So what exactly is a salivary mucocele? Imagine your pet has several salivary glands that produce saliva to help with digestion. This saliva travels through tiny ducts into the mouth. A mucocele happens when one of these ducts gets damaged or blocked. Instead of flowing into the mouth, the saliva leaks out and accumulates under the skin, forming a soft, painless, fluid-filled pocket. Think of it like a water balloon filling up where it shouldn't be. This is the swelling you see, most often under the neck or jaw, but it can also occur under the tongue or near the eye. Now you might be wondering, how does this even happen? What causes the damage? The truth is, in most cases, the exact cause is never found. It's what we call idiopathic. However, some common triggers can include trauma to the head or neck area, maybe from rough play, chewing on a hard object, or even a collar that's too tight. It can also be caused by infections in the salivary gland or, in rare cases, a blockage from a salivary stone or even a tumor. It's important to know that any breed of dog or cat can develop a mucocele, though it seems to be more common in breeds like German Shepherds, Poodles, and Dachshunds. The most obvious symptom, of course, is the swelling. This lump is typically soft, fluctuant, meaning it feels like it's filled with fluid and usually not painful to the touch. If the mucocele is under the tongue, you might notice your pet having trouble eating, drooling excessively, or you might see a pinkish, fluid-filled sac in their mouth. If it's near the eye, it could cause the eye to bulge. In some cases, if the mucocele gets large enough, it can put pressure on the throat, leading to difficulty breathing or swallowing. This is rare, but it highlights why you should never ignore a new lump or bump, so you found a swelling on your pet. What's the next step? A trip to the vet is essential. Your veterinarian will perform a physical exam and will likely want to take a small sample of the fluid from the swelling with a needle. This procedure is called fine needle aspiration. The fluid from a mucocele is usually thick, stringy, and yellowish or slightly blood-tinged, which is a big clue for diagnosis. This also helps rule out other more serious causes of swelling, like an abscess or a tumor. Don't try to diagnose this at home. A proper diagnosis is key. Once a salivary mucocele is confirmed, what are the treatment options? Sometimes, simply draining the fluid can provide temporary relief, but the sac will almost always fill back up because the damaged duct is still leaking. For this reason, the most effective and permanent solution is surgery. The goal of the surgery is to remove the affected salivary gland and the associated duct. By removing the source of the saliva, the mucocele can't reform. It might sound scary to remove a salivary gland, but don't worry, your pet has plenty of other glands to pick up the slack, and they'll be able to eat and drool just fine after they recover. The surgery is highly successful and typically provides a permanent cure. The key takeaway here is to always be vigilant about your pet's health. If you notice any new lumps, bumps, or swelling, no matter how small, get it checked out by your vet right away. While a salivary mucocele is generally not life-threatening, it needs proper diagnosis and treatment to resolve it and to ensure it's not something more serious. Prompt veterinary care is always the best course of action. I hope this video helps demystify what a salivary mucocele is. It can be a worrying discovery, but with the right veterinary care, it's a very treatable condition. If you found this information helpful, please give this video a thumbs up and consider subscribing for more pet health content. Thanks for watching, and we'll see you in the next one.